Hello, welcome to the Mission Peak Health launch of the first webinar. Thank you very much for coming. I really appreciate it. You will be finding out some very important information for you and your health. I'm Eva Maria Tisdale, and my purpose has always been focused on helping and teaching people to make life better for themselves. I recently retired from a long and good run working in the healthcare industry, and this experience has led me to put my full energy and knowledge into the prevention rather than symptomatic practice of medicine. I met Dr. Bryan 10 years ago and learned during this time how his advanced scientific research of nitric oxide of 20 years has opened up significant understanding of human health and disease and paved the way to new treatments and therapies. I am pleased to introduce Dr. Nathan Bryan, international leader in the science and molecular medicine and nitric oxide biochemistry, introducing the discovery of nitric oxide as the cell signaling wonder molecule, as it's called, in the cardiovascular system. Dr. Bryan was first to describe nitrite and nitrate as indispensable nutrients for optimal cardiovascular health. He was the first to demonstrate and discover an endocrine function of nitric oxide via the formation of inorganic nitrates and other chemistry. He will explain that to you. Please welcome Dr. Nathan Bryan. Thank you so much for coming, Dr. Bryan.
Hi, Eva. Thank you very much for the kind introduction, and thanks for your years of friendship and support. It's the beauty of what I do, and really one of the most gratifying things are the people that I get to meet, and just the good people. So thanks, Eva, for helping to advance our mission to really educate the world on the importance of nitric oxide. So with that, we'll go ahead and get started. As Eva said, my name is Nathan Bryan, and so what I thought we would do today in kind of introducing the science of nitric oxide, the history behind its discovery, but really most importantly, talk about the clinical applications and how we can hopefully educate and inform not just physicians, but people all around the world on the importance of nitric oxide, and then empower them to take steps to prevent this age-related loss of nitric oxide production that will eventually lead to the prevention of the onset and progression of chronic disease. But I've been in academia for more than 20 years. Really, my research program has been designed to answer 4 fundamental questions, and that's: how does the human body produce nitric oxide? What goes wrong in people that can't make it? How do they present clinically? And then how do you fix or restore endogenous NO production? And this 20 years of research has led to dozens of issued U.S. international patents, published over 100 peer-reviewed papers, and I've delivered, I think, over 300 lectures now worldwide. These are my conflicts of interest. We've commercialized a lot of the discoveries. These are the companies I've started and productized our discoveries. I'm going to talk about, I'm not going to mention products by name, but I'm going to, obviously, Eva and Mission Health Products have our product technology that helping us with our worldwide distribution. But really what I've seen, my job over the past really 20 years, is to see what everyone else has seen, but to think what no one else has thought. And over the course of the next hour, I'm going to take you through those discoveries where we've thought a little bit differently, that really changed the course of nitric oxide, of how we thought about nitric oxide, and certainly how we thought about delivering safe and effective nitric oxide therapeutics. So I've focused my entire professional and academic career on nitric oxide, but I just want to make a very important point here that nitric oxide is foundational for human health and human optimization. But it's not a silver bullet. It's not an end-all, be-all, cure-all. But here's what I've learned, that people get sick for 2 reasons and 2 reasons only. Number one, the body's missing something that it needs, or it's exposed to something that's interrupting normal cellular function, or it's exposed to a toxin. So if we can replete missing nutrients and minerals, and we can eliminate from the body toxins that we may be exposed to, then the body heals itself. But whether you're missing an essential nutrient or you're exposed to a toxin, what we've learned is that the end result of that is the disruption of nitric oxide production, which leads to decreased circulation, increased inflammation, oxidative stress, and immune dysfunction. And those are the hallmarks of every single age-related chronic disease. Doesn't matter if it's cardiovascular disease, Alzheimer's, diabetes, autoimmune disease, or cancer. It's always decreased circulation, inflammation, oxidative stress, and immune dysfunction. And what I'm going to share with you tonight is if you can restore the production of nitric oxide, you can overcome all of these hallmarks of every single chronic disease. And I want to start with looking at really SPECT scans, and these are non-invasive imaging modalities that look at blood flow and how well perfused individual organs are. And so this is the work of Daniel Amen, who has the largest database of SPECT scans of probably anybody in the world. But what we're looking for in SPECT scans is a nicely contoured image of the brain. So what this is illustrative of optimal blood flow. So every part of the brain is nicely perfused. If you look on the right here, this is a former NFL player with chronic traumatic encephalopathy from many concussions. And you can see these holes in the brain are reflective of focal ischemia. And what that means is where there's holes in this image is there's decreased blood flow. So this shows us radiographically that there's parts of the brain that aren't getting adequate blood flow. And then obviously this is an angiogram of the heart, and you can see in this patient on the left that has a thrombus in the left circumflex here. So this patient's presented with acute MI. You can see in the cath lab that there's no blood flow going through this left circumflex. But if you can aspirate the thrombus, you can restore normal blood flow in the left circumflex here, and you can actually restore normal cardiac function. And then if you go a little bit deeper and look at neuropathy or neurons, all neurons have a blood supply, and these are the microvessels, the small blood vessels, the capillaries that blood supply the sodium, potassium needed to initiate an action potential. And as long as these neurons are adequately perfused, meaning that you have healthy blood vessels, then these neurons, whether they're sensory or motor neurons, can perform normally. But when you start to develop microvascular disease and these blood vessels become constricted and you can no longer perfuse these neurons, then you develop neuropathy. So the whole point of these three, whether you're looking at the brain, the heart, or even into sensory or motor neurons, that all of these are characterized by decreased blood flow to the affected tissue. And if you can restore blood flow and perfusion to these organs and tissues and cells, you can correct many of these conditions. And really, that's the role and the function of nitric oxide. And this very simple molecule, it's a gas. It's produced, and once it's produced, it's gone in less than a second. And during that second that it's around, it's a signaling molecule. So it activates a number of signaling mechanisms, and we're gonna focus on a few of those. But in 1998, a Nobel Prize was awarded for the discovery of nitric oxide. And this is a famous quote by Val Pfister, who was president of the American Heart Association, who said that the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. And we're 26 years after the Nobel Prize, and that statement still holds true. And I like to show this slide because this was a very important publication in 2015 showing that nitric oxide is required for oxygen uptake and oxygen delivery. So the cardiopulmonary cycle is really a three-gas system. We breathe in oxygen, oxygen binds to the iron of hemoglobin, and then when it goes from the arteries to the vein, the hemoglobin undergoes a structural change where it delivers oxygen, picks up carbon dioxide, we excrete carbon dioxide in the exhaled breath. But nitric oxide is required for this entire gas exchange to occur. And if you don't have nitric oxide, then you cannot deliver oxygen to the periphery. And you basically lead to a constriction of the pulmonary arteries. You get a mismatch in ventilation to perfusion, and patients become hypoxic. And eventually you run out of oxygen and people die. So the whole point of this is you need nitric oxide to deliver oxygen. What I'm going to show you is you need oxygen to make nitric oxide. So this is a codependent relationship here. And if you can't make nitric oxide, you can't deliver oxygen. And when you develop a lack of oxygen, you can't make nitric oxide. So this is a perpetual cycle that I'm going to show you. We've been able to interrupt and basically potentiate this entire signaling. But nitric oxide does a number of important functions in the human body. It maintains the integrity of the cardiovascular system. It's the molecule in the gut that maintains gut motility in the peripheral nervous system. I'm going to spend a little bit of time on its role in regenerative medicine and mobilizing stem cells. It's a neurotransmitter in the central nervous system. It controls cell proliferation and cell cycle. So nitric oxide is critically important in metastatic disease and cancer. I'm not going to, in an hour, I don't have time to cover all of these, but just know that cancer is a hypoxic mitochondrial dysfunction disease, and nitric oxide is what controls and regulates oxygen delivery, oxygenates tissue, recouples the electron transport chain of the mitochondria, and basically overcomes all the metabolic phenotypes of metastatic disease and tumor proliferation in cancer. It's a bronchodilator. It's a molecule that leads to vasodilation in the sex organs responsible for sexual function. And it's produced by our immune system to kill off invading pathogens, from preventing virus from replicating and shutting down the respiration of bacteria. So when you become deficient in nitric oxide, you can see here, you can hopefully begin to appreciate, you develop a lot of symptoms. And in fact, a lot of these symptoms and disease that manifest of nitric oxide deficiency are really the poorly managed chronic diseases that we're faced with, not only in the US, but globally. And this I've taken from the Nobel website that Bob Furchgott, Lou Ignarro, and Fred Murad shared the Nobel Prize in 1998 for their discoveries of nitric oxide as a signaling molecule in the cardiovascular system. And it was Fred Murad who recruited me to join the faculty of UT Medical School in Houston back in 2005. Lou Ignarro remains a close friend and colleague who's written the foreword to several of my textbooks. But let's start from like a 50,000-foot view, and then we'll kind of delve into the kind of the basics of biochemistry. And don't just bear with me, because I'm going to show you some biochemistry. But the point of here is I want to show you the understanding that we've gained over the course of these discoveries that led us to our current understanding of nitric oxide. But what I want to start with is, kind of broadly speaking, there are three main hypotheses in kind of aging and chronic disease. So there's telomere shortening, mitochondrial dysfunction, and then loss of stem cell function and repair. And I'm going to go through each of these step by step. But about 20 years ago, I presented this concept that nitric oxide is really the unified theory of aging, because it's nitric oxide that controls and regulates telomerase activity, mitochondrial biogenesis and function, and it's the signal that tells our own stem cells to mobilize and differentiate. So when you lose the ability to make nitric oxide, you basically prevent the upregulation of all these anti-aging pathways. So the loss of nitric oxide precedes all these other steps and signals that lead to early demise, onset of chronic disease. So the telomeres, for those of you who don't know, telomeres are the ends of the chromosomes that with each cellular replication, these telomeres get shorter. Just shorter telomeres, shorter lifespan. And that's very clear. The data go back, more than 20, 25 years. So telomeres, and I thought I had a picture of the telomeres, maybe I didn't. But here's the role of nitric oxide. These are the seminal papers here showing that nitric oxide actually activates the telomerase enzyme and prevents telomere shortening. And nitric oxide is the master signaling molecule in the regulation of telomerase activity and provides the opportunity for therapeutic approaches based on using nitric oxide as an intervention. So not only does it control the function and the activity of the telomerase enzyme, a functional nitric oxide synthase enzyme is required for the genetic translation and transcription, the transcription and translation of the telomerase enzyme. So without an active nitric oxide producing enzyme, you don't get genetic translation and expression of the telomerase enzyme. And then what about mitochondria? Mitochondria are the energy producing organelles of the cell. Every age-related disease shows mitochondrial dysfunction and lower numbers of mitochondria per cell. And it's nitric oxide that regulates energy production, reactive oxygen species, cell signaling, biogenesis, metabolism, and bioenergetics. And the mechanism of this is very well elucidated. So you look at things like caloric restriction, intermittent fasting, a ketogenic diet, things like that, physical exercise. All of these are protective and lead to increased lifespan and health optimization because they're activating the eNOS enzyme, which then leads to nitric oxide, activation of cyclic GMP. And this induces PGC1 alpha, mitochondrial biogenesis, and everything we know about longevity. The point I want to make here is that this eNOS enzyme has to be functional. And in people that have endothelial dysfunction or nitric oxide deficient, this enzyme becomes uncoupled and it no longer produces nitric oxide, even when activated by caloric restriction or physical exercise. So we must restore the function of this enzyme in order for all these other modalities to have a physiological effect. So in patients that have endothelial dysfunction, meaning the eNOS is uncoupled, they can do caloric restriction, you can do intermittent fasting, you can exercise, but until you restore the function of this enzyme, you're never going to get the benefits of those modalities. And the other important thing is that nitric oxide actually extends the oxygen gradient into tissue. And this is why it's important for exercise performance. Nitric oxide improves endurance, and it's how well-trained athletes outcompete the competition. Well-trained athletes actually make more nitric oxide than kind of the weekend warrior or somebody who's not a well-trained athlete. And that's why they outperform the competition. And again, mechanistically, we know that nitric oxide can interrupt electron leakage from complex 1 and complex 4 and improve oxygenation of tissue, improve the oxygen gradient, improve exercise efficiency, decrease reactive oxygen species. So again, everything we know about optimization, energy production, and mitochondrial function can be explained by nitric oxide. And then what about stem cells? You know, we're constantly wearing ourselves out, and aging is just the loss of the ability to repair and replace dysfunctional cells. And we have a number of resident stem cells, and really aging is just a matter of an increase in damage, but a matter of failure to replace it due to the decrease. It's not just decreased number of stem cells, but it's the mobilization of stem cells. And so these seminal papers back, from 2003 show that nitric oxide is the signal that tells our own stem cells to mobilize and differentiate. So if you can't make nitric oxide, the stem cells, the resident stem cells in our bone marrow, in our adipose tissue, don't get the signal to ever go and replace dysfunctional cells. So if we can restore nitric oxide, we can mobilize stem cells and lead to increased repair and the replacement of dysfunctional cells. And you've probably heard of the zombie cells or senescent cells, and those occur when the body loses its ability to make nitric oxide. If we can restore nitric oxide, you can mobilize stem cells, get rid of senescent cells, and have optimal cellular function, tissue function, and organ function. But this goes back to a 400-year-old theory, or not a theory, but really the principles of vascular biology. So the older we get, the less nitric oxide we make. The less nitric oxide we make, we start to get plaque deposition, plaque instability, plaque rupture, and that's the #1 killer of men and women worldwide, cardiovascular disease. The functional loss of nitric oxide precedes these structural changes by many years. So if you have what's called carotid intima media thickness, and you can get this tested through an ultrasound, then that means if you've got an intima hyperplasia, then you've lost the ability to, you've been nitric oxide deficient for 10 to 15 years. And if you have unstable plaque, then you've had nitric oxide deficiency for decades. But if you can restore the production of nitric oxide, you can actually regress disease, you can stabilize plaque, and even if you're at risk for heart attack or stroke, you take nitric oxide, you can prevent that plaque rupture, which is the most important aspect of acute MI or ischemic stroke. So now let's dig a little bit deeper. And mechanistically, we know what causes arteries to age. It's what I talked about earlier. It's inflammation, it's immune dysfunction, and oxidative stress. And I'm going to take you through the discoveries we made that basically shows that if you can restore the production of nitric oxide, you can reduce inflammation, you can eliminate the immune dysfunction, and you can completely suppress the oxidative stress. There are 3 main sources of oxidative stress in the human body. There's an enzyme called NADPH oxidase. Nitric oxide suppresses the superoxide production by this enzyme. There's an uncoupled electron transport chain. Nitrite and nitric oxide recouple the electron transport chain and inhibit superoxide production. And then there's an uncoupled NOS. So the enzyme that typically makes nitric oxide, if it becomes uncoupled, it actually produces superoxide. In our 2009 paper, we showed that we can actually prevent the uncoupling of the NOS and reverse endothelial dysfunction. So if we can just restore the production or provide nitric oxide, you basically eliminate oxidative stress. So the fundamental question is, how does the human body make nitric oxide, and how do we control and regulate nitric oxide production? And I'm going to go quickly through this because we only have an hour to go through really 20 years of research. But there's two ways the body makes nitric oxide. There's the first pathway that discovered, there's this enzyme nitric oxide synthase that I've mentioned earlier in the lining of the blood vessels. And then there's a backup system where we can get nitric oxide from our diet. And this is the mechanism of a plant-based diet. Green leafy vegetables is converted the nitrate to nitrite to nitric oxide. So one pathway can compensate for the other, but if you have endothelial dysfunction combined with a poor diet, then that leads to a global nitric oxide deficiency, and that's what leads to the onset and progression of chronic disease. And let me show you how the enzyme is designed to work. So this would be the cross-section of a blood vessel. This is the lumen of the blood vessel. This is the single layer of endothelial cells that line all blood vessels. And then surrounding all blood vessels, you have a layer of smooth muscle. So when the smooth muscle contracts, it constricts the blood vessels. When smooth muscle relaxes, it opens up the blood vessels and dilates. And there's different agonists or activators. So shear stress, when we begin to exercise, turns this enzyme on. If this enzyme is coupled and functional, it produces nitric oxide. Nitric oxide's a gas, so it diffuses into the smooth muscle, activates an enzyme called guanylyl cyclase. This enzyme converts GTP into cyclic GMP, and that's what's responsible for the relaxation. And some of you are familiar with this pathway, whether you know it or not, because this is how Viagra works. So nitric oxide turns this switch on, and Viagra keeps it on, right? And that's the reason you're warned against 4-hour erections and an unsafe drop in blood pressure. But 50% of the men that are prescribed Viagra don't respond with better erections. And the reason for that is, in order for these drugs to work, you have to have some level of nitric oxide being produced to activate the second messenger cyclic GMP. So in patients who don't make nitric oxide, these drugs do not work. And those are the 50% of the men who don't respond to Viagra or other PD5 inhibition therapy. And these are the data. The older we get, typically the less nitric oxide we make. So our whole thought process was, if we can understand how the human body makes nitric oxide, can we prevent this age-related decline in nitric oxide production? And the short answer is yes. So this is a population-based studies, but this doesn't have to be the case, because I turned 50 several months ago, but I've got the vascular age and the nitric oxide production of a 30-year-old. And to the contrary, we see 20 or 30-year-old kids and young people who have the vascular age of a 60 or 70-year-old. So we know how to shift this to the curve, to the right and to the left, and prevent the age-related decline in nitric oxide production. And here's the data to corroborate what I said earlier, that nitric oxide predicts exercise capacity. So these are well-trained athletes. If you produce nitric oxide, it predicts exercise capacity. If we repeat that same experiment in older patients with endothelial dysfunction, they fail to increase nitric oxide upon exercise. So this is diagnostic for endothelial dysfunction and really coronary artery disease. So the nitric oxide synthase enzyme converts an amino acid L-arginine to nitric oxide. But this enzyme is a very complex, complicated reaction, and it requires a coupled enzyme. It requires tetrahydrobiopterin, glutathione, oxygen, magnesium, NADPH, FAD, and heme iron. 75% of Americans are deficient in magnesium, which leads to NOS uncoupling. Most people have oxidative stress, which oxidizes BH4. It leads to NOS uncoupling and insufficient nitric oxide production. So historically, you may be familiar with a number of hundreds, dozens certainly, if not hundreds of nitric oxide products that have L-arginine. And people thought for years, well, let's just give L-arginine and hope that we can produce nitric oxide. Well, that doesn't work. If you give L-arginine to patients who have just suffered a heart attack, the patients actually get worse. In fact, it increases mortality. And this 2006 paper published in the Journal of American Medical Association showed that arginine, when added to post-infarct therapies, does not improve vascular stiffness and may be associated with higher post-infarct mortality, which means giving L-arginine to patients with an uncoupled NOS kills people. Arginine should not be recommended following acute MI. Same thing happens in patients with peripheral artery disease. These patients have endothelial dysfunction. They're unable to utilize arginine to make nitric oxide. Giving more arginine makes patients worse. So arginine is not useful as a way to improve nitric oxide production. This is what we thought 25 years ago, but innovations and discoveries in science, we used to use leeches in medicine. 100 years ago. We know better now because there's better ways. So progress means that we don't do the things we did 25 years ago. Now, I want to take you through over the next 10 or 15 minutes on some of the discoveries we made that really changed the way we thought about nitric oxide. And so in this particular experiment here, we were just asking the question, if we increase nitric oxide production in the heart, can we prevent injury to the heart in a heart attack? And we did this in mice. So we could transfect these mice and overexpress the nitric oxide synthase enzyme only in the heart. And you can see here, this Western blot here shows that there's increased expression of the NOS enzyme. It's actually active because it's producing a lot of nitric oxide. We can pick these nitric oxide metabolites up in the blood and in the heart tissue. And if we subject these mice to a heart attack, so we basically tie off the coronary artery for 60 minutes, and then we untie it and we perfuse the heart for 24 hours. And then we take the heart and look at the amount of injury to the heart. These hearts, even though they suffered 1 hour of basically no flow, 1 hour of a heart attack, there's no injury to the heart. So then we started looking at the blood levels. We looked at the liver of these mice and found that the liver looked similar to the heart. And you can see here that we were selective in increasing the nitric oxide production only in the heart. There's no overexpression of the nitric oxide synthase in the liver. So then the question was, what does this mean? Then we cut off the blood supply to the liver for 1 hour, and we reperfused for 5 hours. And then we measured these liver enzymes, which are markers of liver injury. And the nitric oxide that was produced in the heart protected the liver from injury. So we published this in 2008 in the Proceedings of the National Academy of Science, showing for the first time that nitric oxide is a hormone, that it can be produced in one biological compartment and have systemic effects. So testosterone in men is produced in the testes, but yet we know it has systemic effects. And if you're doing hormone replacement, you don't have to give injections into the testes, thank God. You can give intramuscular injections of testosterone. You can give sublingual troches. You can do patches. And same thing with estrogen. We don't have to inject estrogen into the ovaries of women to restore the production of a hormone. These have systemic effects. And so our whole thought process from this point on was, all we have to do is generate nitric oxide gas in a single biological compartment. And I'll remind you that the oral cavity, if we can produce nitric oxide gas in the oral cavity, we can restore the replacement of a critical hormone. And then the next question was, well, what about diet? Can we use diet as a means to restore nitric oxide production? And in this model here, again, we use mice, and we basically put the mice on a standard American diet, which is completely depleted of any nitrate or nitrite. And then basically we calculated how much we were losing from putting them on the Western diet, and we just gave this back in the drinking water. So we could modulate these nitric oxide metabolites simply through the diet. And then if we subject these mice to heart attack, you can see the mice on the Western diet have about 40% greater injury to the heart, and they have higher mortality. But if we give this back in the drinking water, we can protect the heart from injury from heart attack, and 100% of these mice survive out to 24 hours. So decreasing injury, decreasing mortality from heart attack. Now we thought, let's take a mice that can't make nitric oxide and put them on a Western diet. And this would be your 50-year-old overweight, hypertensive, diabetic patient with ED who eats a poor diet. And then can we rescue this by giving either nitrite or nitrate in the drinking water? So you can see here, we can completely modulate these nitric oxide metabolites. If we subject these mice that are eNOS deficient on a Western diet, you can see here that they have enormous infarct. So the white tissue here is injury to the heart. But we can completely protect the infarct and injury from the heart simply by giving nitric oxide through these metabolites in the drinking water, nitrite or nitrate. So we could basically use diet to completely intervene and prevent injury from heart attack or stroke. Now, what about diabetes? Diabetes is a global pandemic. It's not just a Western disease anymore. When you get diabetes, this leads to a decrease in nitric oxide production, and that's what's responsible for all the things we know about diabetes, from peripheral neuropathy, increased heart attack, stroke, age-related macular degeneration, diabetic neuropathy, diabetic macular degeneration, and retinopathy. So when we knock out the enzyme that makes nitric oxide in mice, they develop type 2 diabetes. So this told us that if you lose the ability to produce nitric oxide, this leads to insulin resistance and diabetes. And then we've known for 25 years, if you get diabetes, this further suppresses nitric oxide production. So if we could restore nitric oxide production, can we overcome diabetes and insulin resistance? And we published this in 2014, 10 years ago, that when insulin binds to the insulin receptor, that starts a number of signaling cascades. But in every cell, there's an enzyme that makes nitric oxide. But if the enzyme that's in the cell can't make nitric oxide, then what happens? Well, what happens is you develop insulin resistance. And we were able to visualize this in real time because we tagged the GLUT4 protein, which is the terminal step in glucose uptake, to a green fluorescent protein. So we can activate this and we can see that the GLUT4 actually goes to the membrane and binds glucose. So simply by giving nitric oxide donors or inorganic nitrite or S-nitrosyl glutathione, we can improve glucose uptake and potentiate insulin signaling. So we can overcome all the signaling aspects in the metabolic disease of diabetes simply by giving nitric oxide. Because then nitric oxide will post-translationally modify 2 cysteine residues, cause GLUT4 translocation, potentiate insulin signaling, and improve glucose uptake. So diabetes and insulin resistance is a symptom of nitric oxide deficiency. And if you can provide nitric oxide or restore the production of nitric oxide, you can improve insulin signaling and overcome type 2 diabetes. Now, what about vascular inflammation? And I'm going to go into a little bit of detail here because inflammation is the silent killer. And inflammation for us in biochemistry and vascular biology is when the blood vessels become like Velcro. Everything sticks. It causes platelet aggregation, plaque instability, plaque rupture, and then you get a thrombus or embolus and heart attack or stroke. And we learned a lot during COVID because the spike protein causes an upregulation of adhesion molecules. You get vascular inflammation, platelet aggregation, vasoconstriction, thrombosis, and inflammation. And this explained everything we know about COVID, and especially long COVID. The vascular inflammation, the systemic disease that lasted long after the active viral infection. So in 2009, we basically could induce vascular inflammation from a poor diet, and we could visualize this through intravital microscopy. So you can see here, there's a little bit of blood flow going through here, but there's a number of white cells that are stuck to the lining of the blood vessel. So this is the heightened state of vascular inflammation. Now, if we give that same inflammation, but we restore the production of nitric oxide or give nitric oxide, you can see here the blood vessel is more dilated, but these monocytes don't stick and they don't migrate. So even in a poor diet, if we give nitric oxide, you completely inhibit the inflammatory response to a poor diet. And here's the paper we published in 2009, showing that we could completely inhibit inflammation in the lining of the blood vessels due to a poor diet. Now, understanding how diet can affect nitric oxide production, we want to say, okay, how do we optimize our diet so we can overcome nitric oxide deficiency? And this goes back to the environmental nitrogen cycle. The air we breathe is 78% nitrogen. That nitrogen is fixed through nitrogen-fixing bacteria or through lightning. And then the cows, the animals that eat the grass, and then we eat these animals, then we're getting a source of nitric oxide. Or the plants that are grown in the soils, we consume these plants, we're getting these nitrogen oxides that the body can then convert into nitric oxide gas. So this is called nitrification. The human body is a denitrifying process. So when we eat, for example, spinach or green leafy vegetables, 90 minutes after we consume this, the nitrate in these vegetables is taken up in the gut, concentrated in our salivary glands, and this takes 90 minutes. So now 90 minutes after we consume this salad, we secrete nitrate from our salivary glands. There are bacteria that live on the crypts of the tongue that reduce nitrate to nitrite. And then when we swallow our own saliva, the nitrite produces nitric oxide gas. So go back with me. Remember when I told you that if we produce nitric oxide in a single biological compartment, it would have systemic effects. That's why vegetarian plant-based diets are cardioprotective, because if you have the right bacteria and you have stomach acid, we're producing nitric oxide in the lumen of the stomach, and we're replacing this critical hormone. So I'm going to take you step by step because there's steps in this process that are required to produce nitric oxide. Number one, we have to get enough nitrate from the diet. The standard American diet, we're only getting about 150 milligrams per day, and we need 300 to 400. So the standard American diet is depleted in nitrate. And we've modeled different dietary patterns. So the dietary approaches to stop hypertension, the Japanese diet, contain more than enough nitrate to produce nitric oxide to lower blood pressure. The next question was, well, how much broccoli, celery, spinach would I need to eat in order to get this 300 to 400 milligrams of nitrate? So to answer this question, we went to Chicago, Dallas, Los Angeles, New York, and Raleigh, and we just bought vegetables off the shelf. We brought it back to the lab. We ground it up. We analyzed it for nitrate. And this is the table from a figure we published in 2015 with a lot of numbers, but let me make this simple for you. Let's look at celery. If you lived in Dallas or Los Angeles, you could go to the store and buy 5 stalks of celery, eat those, and get enough nitrate to manage your blood pressure. If you lived in New York, you're going to have to eat about 50 or 60 stalks of that celery in order to get enough nitrate to lower your blood pressure. And it's the same across these vegetable categories. So there are regional differences in the amount of nitrate in these vegetables. And these are conventionally grown vegetables. We compared this to organically grown vegetables, and on average, organic has about 10 times less nitrate than organically grown vegetables. So it's very hard to eat enough organic vegetables to get enough nitrate to manage your blood pressure. And most people don't even know what organic means, right? It's just something we've been programmed to like and take. But organic, to get an organic label, obviously there's no herbicides or pesticides added, but you can't add nitrogen-based fertilizers to the soil. Without nitrogen, you can't assimilate nitrate. Without nitrogen, you can't assimilate other nutrients in these vegetables. So organic is good because you're not being exposed to herbicides or pesticides, but organic vegetables are completely depleted in most minerals and vitamins, including nitrate. The other problem is mouthwash. 2 out of 3 Americans wake up every morning and use mouthwash, killing their oral microbiome, shutting down nitric oxide production, and 2 out of 3 Americans have an unsafe elevation in blood pressure. The other problem is fluoride in toothpaste. Most toothpaste have fluoride. Fluoride's an antiseptic, kills your thyroid, and it's a neurotoxin. And then there's 200 million prescriptions written for antacids every year, 200 million prescriptions written for antibiotics every year. So this is a problem. And here are the data. If you take normal intensive patients and you give them mouthwash for 7 days, their blood pressure goes up. Mouthwash kills the oral microbiome responsible for producing nitric oxide, which then causes an increase in blood pressure. And an increase in blood pressure is the #1 risk factor for the #1 killer of men and women worldwide. So we started on this project about 20 years ago because the microbiome, the bacteria that live in and on our body, provide about 3 million gene products. The human genome only provides about 23,000 gene products. So we started doing tongue scrapings of patients walking around the Texas Medical Center trying to figure out, could we culture these bacteria? And do these bacteria that live on the crypts of the tongue have any effect on blood pressure? And here are the data we published in 2014 that we found that the people who had the best blood pressure had the greatest diversity in the oral microbiome. People who had pre-hypertension or hypertension had the least diverse microbiome. In fact, there were no nitrate-reducing bacteria that we could culture in the patients who had high blood pressure. So this was a nice association, but not causation. Next, we went back and we only enrolled healthy individuals, young people with normal blood pressure. And then we gave them mouthwash for 7 days, monitored their blood pressure, did daily tongue scrapings. And then after 7 days, what happened to their blood pressure? Then we took them off the antiseptic for 4 days, brought them back, looked at their blood pressure and their oral microbiome. And this is from a paper we published in 2019. 7 days after mouthwash, we saw a 26 millimeter increase in blood pressure. So this is a 21-year-old dental student. 7 days of mouthwash, we made him clinically hypertensive. We didn't change his diet. He was on no medication. We didn't change his exercise. All we did was kill his oral bacteria. And we made him clinically hypertensive. Fortunately, 4 days after stopping the mouthwash, his blood pressure normalized. But we were able to detect the bacteria that disappeared when his blood pressure went up And we identified the bacteria that reappeared the day his blood pressure normalized. We sequenced these bacteria. They were expressing these nitric oxide producing enzymes, showing for the first time that hypertension is a symptom of oral dysbiosis. So we could predict steady state blood pressure by the presence and number of these 4 bacteria. So in people who don't have these bacteria, because they have oral dysbiosis or using mouthwash or fluoride toothpaste, they see an elevation in blood pressure. And they become resistant to antihypertensive medications because ACE inhibitors, ARBs, calcium channel antagonists aren't going to normalize their blood pressure because it's a symptom of oral dysbiosis. So these drugs can't work to normalize their blood pressure because it's the wrong target. Now, for the first time in the history of medicine, we can start weaning people off of blood pressure medicine. Because now if you ask your patients, hey, are you using mouthwash? Do you have fluoride in your toothpaste? Most everybody says yes. Okay, we'll stop using it. 30 days later, you come back and their blood pressure is normal. And there's no need for antihypertensives. So understanding all that, we started developing nitric oxide product technologies. And I'm going to take you very quickly through the published clinical trials, but all these are in the published literature. So I made an orally disintegrating tablet that when you put this lozenge in your mouth, it produces nitric oxide gas. We can detect it. 6 minutes after it's completely dissolved, the nitric oxide goes away. Peak plasma concentrations within 20 minutes. It normalizes blood pressure. Within 20 minutes of taking the lozenge, we see a statistically significant reduction in both systolic and diastolic blood pressure. 60 minutes later, again, long after that lozenge is gone, we're still seeing a significant reduction in blood pressure. And then 15 minutes or 4 hours after that single lozenge, we see a 20% improvement in nitric oxide production. So not only are we, if your body can't make nitric oxide, the lozenge does it for you, but we've improved the body's ability to make it on its own. If we look at the carotid artery in the neck, we can see, get baseline pictures. 10 minutes after the lozenge, we've dilated the blood vessels by 13%. That's a 34% increase in blood flow to the brain. Patients with cardiovascular disease, we see 11% plaque regression in 6 months. And then this is a pediatric patient that we started studying in 2007, 2008. These patients are born without an enzyme called arginosuccinate lyase. This is a very complex inborn error metabolism. But the point here is these kids start developing systemic disease that couldn't be explained by their underlying genetic disorder. They had resistant hypertension, they had kidney disease, they had liver disease, blood clotting disorders. So these physicians came to me in 2007 to try to help them understand this disease. And what we discovered, and we published this in Nature Medicine in 2011, was that this ASL enzyme, this critical protein that these patients are missing, is what tethers the nitric oxide synthase enzyme to the membrane. So in these patients who don't have this protein, this entire complex falls apart, and they're unable to produce nitric oxide. So the inability to produce nitric oxide actually explains all of these other symptoms. So then we started an intervention, and we took one patient here. You can see at 5 years of age, he was diagnosed, had severe hypertension, uncontrolled with medication. And in February of 2010, he came to Texas Children's Hospital. He was in the intensive care unit of a blood pressure of 200 over 110, a 15-year-old kid in hypertensive crisis. No known therapies would lower his blood pressure. They started dosing him with isosorbide, which is metabolized into nitric oxide. And within 4 days, he was released from the hospital. And he did pretty well. But a year later, he came back and had developed tolerance to these drugs. And when we saw him at Texas Children's Hospital, his blood pressure was 185 over 110. We dosed him with our nitric oxide lozenge. Within 4 hours, his blood pressure completely normalized. We followed him out for, I think, 20 months. We published this in 2012. And we got him off all prescription medication simply by giving him our nitric oxide lozenge. Even in a kid with a rare genetic disorder, the nitric oxide completely rescued his symptoms. His heart disease resolved within 5 months. His kidney disease resolved within 5 days. So we completely overcome this kid's genetic disorder simply by giving nitric oxide gas. And this is meaningful because if you lower blood pressure by 5 millimeters of mercury, you can reduce the risk of stroke by 34% and reduce the risk of ischemic heart disease by 21%. We brought this kid's blood pressure from 185 over 115 to 130 over 80 in 4 hours. And once we realized we could make nitric oxide, now we adapted this to different product technologies. And now we make a topical nitric oxide for skincare and beauty. Now we're developing this into a topical drug for diabetic ulcers and non-healing wounds. But I made a dual chamber nitric oxide serum. You take one pump from each side, you mix it together, it produces nitric oxide gas. And when you do this to the skin, you can see this is using the serum twice a day for 30 days. These age spots disappear. Inflammation on the skin is resolved. Tone, texture, and clarity on the neck. This inflamed neck here 30 days later was completely resolved. The broken blood vessels here, this is a 50-year-old Hispanic lady. You can see here the tone, texture, and clarity. The varicose veins go away. This lady here underwent a facelift and then went home and started smoking, developed a full-thickness ulcer. We applied the serum here 3 times a day for 10 days and got complete closure of a full-thickness ulcer. Polycystic acne, this poor lady here had developed severe acne over the course of several years, unresolved. With anything she did within 30 days, we completely eradicated the acne. And you can see here the skin tone, texture, and clarity completely improved. This is a 15-year-old scar from teenage acne. Using the serum for 30 days, again, completely remodeled the face, mobilized stem cells, and within 30 days, almost got complete resolution of a 15-year-old acne scar. The nitric oxide topical is antibacterial. Now we're developing this as a topical drug for diabetic ulcers. You can see here this diabetic foot ulcer, 3 years non-healing, we heal it within 30 days. Second-degree burn, 21 days of using the serum, complete healing, no scar formation. This is a 64-year-old paraplegic with a non-healing ulcer for 4 years, added the serum. This is 2 to 3 times a day. In 195 days, completely healed this 3-year-old non-healing wound. Now, let me close this by saying that really what we're doing is recapitulating nature. Because we went to Tibet. These people live at 12,000 feet above sea level, but yet these natives up there don't develop altitude sickness. But yet if we ascend to 12,000 feet, we develop high altitude pulmonary edema, mountain sickness, and people die. So our question was, how do these people that live in high altitude adapt to that low oxygen? And what we found is that even though they're breathing in less oxygen, they're delivering more oxygen per unit time than people living at sea level. And they do this through the production of nitric oxide. So the people who live in Tibet produce about 100 times more nitric oxide than we do at sea level. We compared this to people living in Houston at the medical center or Cleveland. So the ability to produce nitric oxide, the adaptive effects of low oxygen are offset by improving nitric oxide production. And that's the beauty of what we do. If your body can't make nitric oxide, our product technology does it for you. Now we can adapt patients to low oxygen. So people, if you're going snow skiing every year and you developed altitude sickness, take the lozenge, it'll acclimate for you. So let me just wrap up here the next couple of minutes, then we'll open it up for questions. But you know, I tell people all the time, you have to do 2 things to improve nitric oxide production. You got to stop doing the things that disrupt it and start doing the things that promote it. So if you're using mouthwash, you have to stop. Mouthwash kills the oral microbiome, shuts down nitric oxide production, and leads to an increase in blood pressure. And you have to get rid of fluoride. Use a non-fluorinated toothpaste. Fluoride is an antiseptic, kills the good bacteria. And if you're using antacids, you have to stop. People who have been on proton pump inhibitors for 3 to 5 years, 40% higher incidence of heart attack, stroke, and Alzheimer's. Your body cannot digest protein, cannot heal without stomach acid. And then get rid of the sugar. You know, there are companies out there trying to sell you beet gummies and beet chews and sugar. It's junk. We don't need more sugar. You have to eliminate sugar from your diet. A balanced diet in moderation, a lot of protein, good fats, very little carbs. And then throw in some more green leafy vegetables, exercise, sunlight, 20, 30 minutes of sunlight or infrared sauna. And then if you don't want to do that, then we have products that do it for you. But look, everybody panics when we see the red light come on our smartphone. And what do? We go charge it. Well, the human body has a red light, and that's ED. It's high blood pressure. It's autoimmune disease. So that tells you something's wrong. We need to charge. We need to supplement nitric oxide. And so our body is electric by nature, and we have to provide a source of nitric oxide. This is a paper I published in 2004. And the reason I show you this complex biochemistry is that there are a lot of companies out there trying to sell you nitric oxide products who have no idea what they're doing. If you cannot control and dictate the metabolic fate of nitric oxide, there are a lot of things that can go on here that can cause more harm than provide benefit. So trust those who do the science, who know the science. Beware of deceptive marketing. There are a lot of companies out there trying to defraud you and deceive you into buying their products, and they cannot make nitric oxide. They do not make nitric oxide, so trust the science. And the greatest enemy of knowledge is not ignorance, it's the illusion of knowledge. There are government officials out there who have an illusion of knowledge. There are companies out there who have an illusion of knowledge, and it's dangerous. Ignorance is curable. That's the purpose of this webinar tonight, is to provide information and education so you're no longer ignorant. You can make informed choices and have the information to make informed decisions on what product technology may be best for you. So to conclude, nitric oxide controls and regulates blood flow and oxygen delivery in every cell in the body. There's an age-related decline. This doesn't have to be the case. Again, we can prevent that. Diet and exercise are not always sufficient, especially if you're using mouthwash, fluoride, or antacids. We're absolutely convinced that nitric oxide will change the landscape of medicine, have a profound impact on public health and the future of medicine. But we must use safe and effective nitric oxide product technology, and your body cannot and will not heal without nitric oxide. I like this quote because I've lived this, I've survived it. You know, what we've done here are fundamental truths, and these truths pass through 3 stages. First, it's ridiculed. Second, it's violently opposed. And third, it's accepted as being self-evident. I've been ridiculed, you know, for the past 20 years. Now we're being violently opposed by companies, by big pharma, by other companies who are selling inferior nitric oxide products, because what we do is very disruptive. And I expect it to be violently opposed. But we will see this as being self-evident, because these are fundamental truths based on basic biochemistry and physiology. So with that, I'll leave you with a couple of references. Here's my email. You can follow me on social media. Got an educational website here. But for those of you interested in the product technology, reach out to Eva. She provides our product to consumers, to doctors. And so with that, I'll open it up for questions. And again, I want to thank you so much for your time. You know, time is one of our most valuable assets, and it means a lot that you've sacrificed an hour of your time tonight to learn a little bit about nitric oxide and hopefully how it can transform your life. So with Eva, I want to thank you again for the opportunity, the invite to present and really partner with you to change the world and to impact the future of medicine. So with that, you can put your questions in the chat, or we can open it up and unmute you and we can just have a conversation. But I've got about 7 or 8 minutes here, and then I've got a hard stop at 7 Central because I got another Zoom call and another meeting. But if we don't get your questions answered, you can certainly contact me on email. Let me see how I can get my screen back. Yeah, I'll leave my email up here, to where if we don't get your questions answered tonight, just please email me and I'll always answer your questions. But let's open it up. If you got questions, put it in the chat, or just unmute yourself and we can do it verbally. Eva, Jesse, can you hear me?
Yep, we're good. You can also
Yes.
raise your hand. If anybody has a question for Dr. Bryan, you can raise your hand and I will unmute you from the attendees panel. I know that Eva had a question relayed from a doctor in Germany. So Eva, if you want to ask Nathan the question, now would be a great time.
Very good. Well, let me get it up and I will be reading this to you.
Okay.
If it does, okay. Hang on a second. This is from a Dr. Diane Kessler, who I met years ago when I was in the testing business, as you recall when we met, right?
Sure.
And she answered and came with this question. It says, can you please tell us something about the NO producing bacteria in our mouth and how an eubiosis can possibly increase the amount of produced NO while dysbiosis can diminish it? Cordially, Dr. Diane Kessler.
Yep. Well, you know, we've learned a lot about these bacteria, and there's about a dozen of these species that we fully characterized that are known nitrate reducers. So Prevotella is one, Veillonella, Neisseria, Haemophilus. So these are the ones that we could culture in the people that had the best blood pressure. And as you can see from our 2019 study, these were the ones that we could predict steady state blood pressure. So for us, what we're finding is that the presence and number of these are what's responsible for maintaining normal blood pressure. So there are a number of things that disrupt this microbiome, the ecology of the microbiome. Mouthwash, whether it's alcohol-based mouthwash like Scope, Listerine, or chemical-based mouthwash like chlorhexidine, completely disrupts the microbiome, kills the good guys, kills the bad guys. The other thing we're finding is that if you have dysbiosis because of an active oral infection, if you've got gingivitis or periodontal disease, and you've got the pathogenic opportunistic bacteria, then what we're finding is the bad bacteria outcompete the good bacteria. So we have to support the healthy microbiome. And then once you have a healthy, diverse microbiome, the good guys act as the police, and they basically keep the bad guys at bay. So we, in dental medicine, which is, basically used the wrong approach for the past 100 years, and we're working with the dental community now, is you can't drop an atomic bomb in the mouth and kill all the bacteria with the hope of, curing gingivitis and periodontal disease. What we have to do is selectively kill the pathogens while supporting the non-pathogenic commensal bacteria and supporting a healthy microbiome. And that's why we're working with the dental community, because chlorhexidine is very detrimental. So we're working to try to figure out how do we selectively kill the bad guys and maintain the good guys. So there's a lot we've learned, but there's still a lot that we don't know. But here's what we do know. If you feed these bacteria, and what we're finding is the lozenge may be the simple solution, because the lozenge, it's placed on the tongue, you can move it around, it kills the bad guys because most pathogenic bacteria are sensitive to nitric oxide, binds to the iron sulfur centers. The good bacteria are the ones that produce nitric oxide from the reduction of nitrate and nitrite. So the lozenge, you put the lozenge in your mouth, it's going to selectively kill the bad guys, and it's going to increase the diversity of the good guys. Or you can eat some more green leafy vegetables. Nitrate's a good prebiotic. But again, if you don't have the right oral bacteria, then can you utilize this? And if you're using antacids, then you don't get the nitric oxide benefits of that.
Mm. Okay. Other questions? Okay.
We have one more question from Pat McBride. She has, or Pat has their hand raised. Pat, if you want to unmute and ask Dr. Bryan a question, he's got about 1.5 minutes before he's got to go.
Can you hear me?
Yep, we can hear you.
So the whole microbiome thing, the prebiotic, the probiotics and all that, is there anything you would recommend, any specific commercial probiotic that could help with the good guys in the oral microbiome?
No, I've tested most oral probiotics, and there's nothing that's commercially available that restores the population of these bacteria. I filed patents on these back probably 10 years ago when we first made these discoveries, and then it was our intent to put this in a prebiotic or probiotic, but the FDA wanted long-term safety studies on non-pathogenic commensal bacteria in their infinite wisdom and knowledge. So we didn't go down that path. But what we're finding is that, nitrate-rich vegetables, nitrate acts as a prebiotic that seems to wake up these bacteria. The lozenge, we're collecting data every day on that. And the lozenge itself, the N101 lozenge, seems to increase the diversity of the oral microbiome and may be, a sufficient prebiotic or probiotic, whatever you want to call it. But to answer your question, there's not a commercially available probiotic that I've seen and tested that's been able to improve these nitrate-reducing bacteria.
Thank you very much. I appreciate your activity in this whole area. Thank you.
Thank you for joining.
All right, Eva, you are up. If you want to take us out,
Well,
gotta go.
Yes, I thank you very much, Dr. Bryan. It was informative. It was a lot of information, and I'm sure that there are many people that are feeling like I do, that it has to be digested. But I have certainly taken the product for a number of years, and I feel like a spring chicken. I'm not, but thank you very much for your time, and I would like to thank all of you, and I say auf Wiedersehen. And if you use the code Peak Health and you would like to have, maybe have buy a bottle of the product and try it, we have a special 15% discount on the website, and that will be activated if you use the code Peak Health. I thank you again for your time, and I will be in touch, and I'm sure will be more. Have a wonderful evening. Thank you.